parents' number, siblings' number. And we thought for a long time, up until more recently, at least within the clinical realm of Huntington's disease care, there's been a lot of smart scientists that have been looking at this for a long time, about whether that number truly is stable. Right? We know when we test the blood that it's stable, but the question is, in the brain, is it stable? And that doesn't seem to really be the case. There is something called somatic instability that over time, there appears to be some expansion. And how much that plays a role in the brain and what we see on the outside when we think of clinically what we see. When we're taking care of people, when we're seeing our loved ones over time, we're still trying to figure that out. And there's a lot more to be understood about that in its relevance to how we take care of people, diagnosing people, what we test for. Because we can't test for that number per se right now. But it also plays a role when we're talking about gene targeting therapies, that if there is an instability in that CAG repeat, then how does that change our approach in terms of therapeutics? And that is how you're seeing the landscape of research change. And I think you're going to get a talk about that later today. And there's now approaches looking at that in particular. So we're moving forward with that. It's a great question.
I don't have a lot more to add. I think Dr. Duffy did an excellent job of explaining it. I think what I do tell families generally is it doesn't mean that we need to check your blood every time to see how quickly it's expanding or not. You can, as Dr. Duffy said, it's something that's happening in the brain, so not something that we necessarily can check in blood at the moment. So I guess the short of it is the answer is yes. That said, I would love for patients and family to some extent don't focus too much on that, because it's not something that there's a lot of companies that are currently working to try to address that specific issue. But more so, for the most part, what we focus on is how you do it in terms of symptoms, and that's what we're following. So yes, but not something we can necessarily measure in blood, and not something that we need to check on regularly right now.
Thank you. This works well. Okay.
How do I approach a family member showing symptoms and obviously needing help? How do I encourage / help them?
Listen, pay attention, show up. We're all in this together. And I don't think any single one of us has the answer to that. But when you give someone your full presence and listen to what they have to say, that's your starting space. Sometimes I talk a lot, as those who know me know. And I really have intentionally started working more on listening, because I think that we miss the story when we want to tell our own story first. And so that's my guidance today.
And I will just add, using we statements versus you statements or I statements. So letting your loved one know, hey, I'm noticing some changes. Can we get together and talk about these things? Can we maybe go to an HDSA Center of Excellence and see what's going on and how we can help each other? Can we go online and ask these questions, check out Help for HD, read some of these resources? Let everyone wants to know they're in this together and that they're not going to be abandoned or left behind. So that's a lot of times what people are scared of. Sometimes they're scared of doctors because they're scary. Look at them up here. No. And it can just be scary. And sometimes it just takes time. It's a process. It's not something that you say we the first time and they're going to be like, yay, let's go. It's a process. Just keep your hand outstretched and offering help, and eventually your loved one will take it. And you can always call Susan and I, and we can help problem solve different situations and help you through that.
I think it's important to remember that you're also not alone, right? There is a team to help you. And sometimes just getting your loved one across the threshold to the medical team and then putting the responsibility on them, in a sense, to talk to your loved ones about what they're seeing and potentially making a diagnosis and maybe moving forward with that journey. But that can be a really difficult first step.
Katie kicked us off with support groups because no, she wasn't going to do that because she didn't need to. And I think just hearing you're not alone, you look around this room and you know that, about reaching out. And so maybe your family member isn't ready to do a support group and you are. Everybody look around this room and see who you can connect with today that may be able to start that conversation. And I think that helps because now we're live and virtual and there's ways to do that.
The only other thing I would add is also keeping in mind why there may be reasons of why the person with the disease may not want to be seeking help, right? We've alluded to some of it. Some of it could be fear. Some of it could be, there's some component of denial at times. But then we also know sometimes some patients may not be aware of what are some of the symptoms or issues that they're experiencing. In other words, you may be able to see they clearly have chorea, voluntary movements, and they're falling, like how they're not seeing it as a problem. And we do know that part of the disease at times has to do with patients not necessarily recognizing what are some of the issues that they're having. So some of it is not, there's a component, there's a psychological component, certainly, and then in some cases there's also a component from a cognitive standpoint, from a thinking standpoint that is directly impacted by the disease, and that's why they may not be recognizing that there's an issue. So I think understanding that can, in some ways, obviously extremely difficult, but I think it can explain some of what could be the frustration of the family of having all those pre-problems, not wanting to seek help. Sometimes it's outside of the control of some of the patients. So putting it in and framing it in that way can help a bit of how you approach it or how you communicate with them or how you communicate with other teams. But definitely seeking for help, support groups, talking to experts and the whole sort of community that is here to help. Just being here today is already a huge step into being able to support the patients.
We live 5+ hours away from a COE, online care ? I think maybe telehealth or something is what they're interested in.
This is common. Most centers of excellence can do telehealth component, video components. Most facilities will want to see you at least once a year in person, if that's possible. And usually our initial visit, we like to see you in person. That's just so we can get to know you and you get to know us, and then we actually can physically see what's going on a lot better than we can on video. Now, video can be really good for in-between visits and things of that nature. So assuming you're in the same state as that COE that's 5.5 hours. If you're across state lines, it gets a little bit more dicey and because there's licensing issues and stuff like that. But if that's the case, reach out to Susan and I and we can kind of help you problem solve, because there are companies out there, not necessarily COEs, but are companies out there that can do medical telehealth, and maybe it's just a consulting type situation. Anyways, we can help you. Reach out and let us know and we can sort out your specific details.
I was going to say reach out either way. We would love, of course, we know that the Centers of Excellence is where you have HE experts, but at the same time, we also know that there may be clinics that don't have the actual designation simply because they don't have enough number of patients. We do know that there's a lot of movement disorder specialists that have had exposure to Huntington's disease also, and that may be comfortable or at least have some familiarity or knowledge with the disease. So don't feel like they're so far and there's nothing that I cannot get the appropriate care. Reach out anyways, and also as part of us as the care team, if you have a neurologist, at least for many of us, we're always open and welcome discussions with local neurologists. And as a matter of fact, even if you were able to come in once a year to a Center of Excellence, it's always good to have some sort of connection with a local neurologist, even if they're not a Huntington specialist, in case that there's an issue, in case that they have to be seen, physically examined right away. So don't let that deter you from connecting to a center of excellence. And again, our role is to be able to facilitate the care with whoever is your closest neurologist or provider.
And we often have partnerships with other neurologists, both within our state and outside of our state. So even though I cannot legally practice across state borders, because that's a medical license, I live in California, and that is where Center of Excellence is. That's where my license is. But we have partners in Nevada, for example, that we partner with that have our numbers and have access to us, attend our educational programs, and that we can support in caring for our HD community. So there is a lot of networks out there beyond what you can necessarily find online. So again, you're not alone. Reach out to your resources.
Perfect. That's always hard.